Professor Rajasekaran, you have to remember that I was asked about 10 minutes back to introduce you. But since உங்களை எனக்கு கொஞ்சம் தெரியும் அப்படிங்கிறதுனால more than anything else, I had worked with your father. Red Crossல we had been working together in the past, so you used to be one of the regular members there. So அதனால I have a fair idea of a celebrity in town. The second thing is that என்னோட பொண்ணு உங்க ஹாஸ்பிடல்ல தான் அவர் ராஜ் சபாபதியோட வேலை பார்த்தாங்க, and she is now in Taiwan doing her oral maxillofacial surgery there on a fellowship. So that is the other thing about Ganga that I am aware of. So friends, Professor Rajasekaran, I mean, how do you introduce a person of this eminence? It is very difficult. So let me try doing this. I basically don't want to read out his biodata, which I have in front of me in the screen, where everyone knows that he's a ortho, and he is also a PhD, and he's a professor, and holds one of the most prestigious chairs of the AO Spine International Board till this end of this year. And right through his life, he has been president of several boards. He has been part of several I would say journal referees, and also being on the editorial board, etc. So that's amazing for a person who has done so much in this area, where he has actually contributed also quite a lot. But the most important part, எனக்கு அவருக்கு காமனா இருந்தது ஒரே ஒரு அக்கம்ப்ளிஷ்மெண்ட் தான் இருந்தது. நாங்க ரெண்டு பேரும் பாரதியார் யூனிவர்சிட்டியில மெம்பர் ஆஃப் தி கவர்னிங் போர்டா இருந்திருக்கோம். இதை தவிர I couldn't find anything common between me and him in terms of any accomplishment. So I'll have to say, அதுதான் அவருடைய பயோடேட்டால நான் பார்த்தோன்னு ரொம்ப ஆச்சரியப்பட்டேன். Because இவ்வளவெல்லாம் போட்டிருந்தாரு, அதில் he has not forgotten the local university. So that is something which I really liked, and I saw it in his publication there. Now I just want to take a step back. Or a year back, Dr. Rajasekaran will remember that he had given around the same time, July 11, ஒரு லெக்சர் கொடுத்திருந்தார் AORAக்கு, where his father also was sitting in the front row, and he had spoken. It was a general topic. It was nothing to do with spine, or it was nothing to do with anything, but basically hard work பத்தி பேசியிருந்தார். I don't know if you remember, doctor, but you had spoken about a year ago. So எனக்கு வந்து அந்த வீடியோ நான் பார்த்திருந்தேன். Obviously I cannot 10 minutes முன்னாடி தான் உங்களை இன்ட்ரோடியூஸ் பண்ண சொன்னாங்க. So obviously I couldn't have gone through the whole interview in 10 minutes unless I was a superman or something. But I had seen this in the past. What is the learning I took from there was I had given it to my students to have a look at it, because there were some very, very interesting facts that you had put there, particularly with respect to hard work, where you had gone on to explain what hard work means, and how the most important and critical element is passion that has to drive that hard work. அப்படின்னு சொல்லிட்டு நீங்க சச்சின் டெண்டுல்கர் பத்தி சொல்லியிருந்தீங்க. அதுல அதாவது அவருடைய லாஸ்ட் மேட்சுக்கு முன்னாடி 20,000 balls ஆடி இருந்தாரு அப்படின்னு சொல்லிட்டு. So one parallel I could see between Sachin Tendulkar and you was, அவரும் வந்து 100 centuries வச்சிருக்காரு. He has got several thousands of runs in different formats of the game, and in several other ways in which he has excelled. So அதே மாதிரி உங்க பயோடேட்டால பார்த்தா 274 publications in international journals, 53 national publications, 447 international plus 550 national. அது கூட்டினீங்கன்னா 1000 வந்துருது. So ரஃபா வந்து அந்த 10,000, I mean அந்த 100 centuries மாதிரி you have also done this, and also 59 chapters in books. So that's amazing journey that you have taken, and I could see that when you meant hard work and passion, and when you compared, I could see that there was a lot of similarities on why somebody succeeds and why somebody doesn't succeed. And the speech, my take home message was 4 things. One is that you had mentioned about your father and how that at the age of 82 he had his PhD done. 79 years la ஆரம்பிச்சு 82 years he had finished his PhD. So it just goes to show எந்த வயசுல என்ன பண்ண முடியும் அப்படிங்கிறது வந்து you had mentioned. So I could see that you had mentioned very clearly that your father and mother were the balanced persons you had met in your life, or you have seen in your life. I really liked it because Ramni Shankar sir kellam theriya enga appa amma. I draw a lot from my parents in terms of what I have actually accomplished in my life. The second thing is that I could see that work and passion, and the way you had mentioned about how you need to do something that interests you. And even 15 hours of work doesn't create a problem, but 15 minutes of something that you do, which is not good, causes serious stress. Work-life balance, Ashish, he had given a new definition. Work-wife balance. Or definition on the slide deck. I had seen that long back. So, that's important. People who really spend long hours away from home, they will know the value of it. If you lose the thread, so I'm absolutely sure that his wife and children are playing a great role in supporting Dr. Rajasekaran on that. So I can sort of go on with a lot of his accomplishments. This is the first time introduction can be longer than the speaker's speech itself. That is unprecedented, and that could happen if I continue on the same line. So it actually gives me great pleasure to welcome Dr. Rajasekaran here to the forum today, and we are all very eager and awaiting his presentation today. Over to you, sir.
Thank you very much, sir. Thank you, President, and thank you to the entire club for giving me this great opportunity. Is my screen seen, sir? Okay. So today I would be talking about one of our global grant projects, which actually has done a tremendous good for a lot of people. So before starting, I should congratulate Rotary worldwide and also our club, because when Jerusalem, Mecca, Vatican, Tirupati, everything is closed, it's very nice to see that Rotary clubs and Rotary movement is still carry on all its really good work. So congratulations, President, Secretary, and all our members for this great work. Now, this project is about actually making life happen and converting people who are dependent to become independent. Now, before starting this presentation, I just opened the website and saw 20 important global grant projects of Rotary in Solitaire. There is a lot of projects from Brazil, Uganda, and everything. There were still minor projects also which were mentioned, but our projects are all not mentioned there. So I thought it's really important that we should also highlight what we are doing under this project. And this basically, if you look at what it is, if I can crystallize into one single sentence, it is giving a rebirth to paralyzed patients and their families, giving another life to them by providing an end-to-end care in one place. Now, we treated more than 350 spinal cord injuries every year. And you know that this is one injury where in a split second, life can change completely. A patient who was leaving the house as the breadwinner of the family, as the head of the family, in 1 second, when he gets a spinal cord injury, he becomes the most dependent person on the family. Now, this can be completely shattering to his morale, to his physique, and can also be a big devastating blow to the entire family. Now, in our country, you will find that one of the most common causes for this is road traffic accident. Now, when things like this happen, the spinal cord gets frequently injured. But very unique to our country is also fall from a height. And in fact, I would like to emphasize on this, and in the end, I will also be proposing a project. Because after the COVID, we found road traffic accidents have considerably come down, but we still had the same amount of, or in fact, a marginally increased admission of spinal cord injuries, because there were a lot of people who were falling down from heights. I'll come to this later. And that was the reason why we had to build a rehabilitation center. Now, whenever a patient came like this, we always operated on them on an emergency basis. And after many years, we actually found that surgery is not it's an important thing, but it is not the most important thing that a paralyzed patient needs. Now, this was actually a big learning point for all of us, because you can operate on a patient and then send him home. But if he is not taught to be independent, and if he is dependent on the family, at a certain point of time, the family structure breaks down, the family support breaks down, and then they go into a lot of complications. And any one of these complications like this, a pressure sore or a urinary tract infection or a lung infection, can be the beginning of the end. And many of these patients die in the end. Now look at these quality indicators, and these are all from the textbooks and literature. If you have a high-level cervical spine injury, at the end of 1 year, 65% of them are already dead. 43% of them suffer from a huge infection, which can be life-threatening. Bad pressure sores are there in 65%. 93% are depressed. It's not just them alone, but also their family members. 23% of them have a divorce, and 14% of them suicide before 2 years. Now, if you look at all these indicators, it is very obvious that these indicators and outcomes are worse than cancer itself. Now, one of the reasons why this happens is that once the patient gets discharged from the hospital, there is no organized care for these patients. Now, the treatment is completely fragmented and complete. Somebody is in charge of transporting these patients to the hospital. Hospital and the surgery treatment is done by a separate group. They go to a different place and the rehabilitation is separate. Nobody looks at occupational therapy. And in our country, there is nothing proactive for a social integration. Now, all of these were the results where it was such poor results. And I have told this story before to some people in Rotary, but I will tell again. This was the origin of this project, and so I need to tell this. So many years before, when I was leaving the hospital at about in the night, when I was crossing the casualty, a group of people came running towards me, and they asked, "Please come, sir. We have brought Palanisamy for you to see." And when I went to the casualty, obviously it was a spinal cord injured patient whom we have operated 8 or 9 months earlier. And he was crouched like this and shivering, and it was very obvious he was in septicemia, probably because of urinary tract infection. He also had a pressure sore. And I told him, "Okay, you require admission." And he said, he and his wife said, "We want to, sir, my wife wants to talk to you in private." Generally, in our country, if somebody wants to talk to you in private, it is to ask for a concession in the fees. But there were a lot of relatives, and the wife alone I took to another cubicle, and then she actually said, "Sir, this is a big request from me and my husband. Please allow him to die, because this is a joint request from both of us." So this was a little bit shocking, and when I asked why, she said, "I cannot go to work because he is like this at home. Children cannot go to school. Every 2 months he has to be admitted with a complication. We have sold everything that we have, and it is our joint decision that he has to die if children have to live." Now, this was such a heart-rending problem, and at that time we decided that we have to do something for this whole group. And then we realized it's not enough if we just operate. It's an important but a small segment of care for these patients. And what is required is a center for end-to-end care is what is required. And that is the origin of this rehabilitation center. So this rehabilitation center is also a good example of the power of good purpose, because I thought it should come up earlier, and for a variable events fell into place, And I should also thank Mr. Ramanishankar sir for making this possible. This rehabilitation center was actually built in 90 days. And it is one of the state, very nice rehabilitation center because it had, from a place where there was no organized rehabilitation, it was possible to get all these people together. And all of them had 6 hours of rehabilitation, and it completely changed their outcome. And we brought in a lot of newer equipments, and it came to a stage, but then it took off in a big way after Rotary Coimbatore Central got into this also. So I should thank here now our Manikam sir was the president at that time when the Global Grant Foundation was there, and Amit Duhar was the secretary. But there were, all they say always say good things happen by itself, but there needs to be some karanakartas to push this through. So I should thank Mahavir Jain sir for putting the project into its nidus and pushing it through. And Suni sir and Balasundaram sir, actually they did all the hard work. And Balasundaram sir has been a big push. I should say that he is the spinal cord of this project. And I know Dr. Prakash and Ashwin also played a huge role in getting this global grant. So I should thank all of them at this stage. So what the Global Grant and Coimbatore Central Rotary did for this is that it donated 61.75 lakhs for very critical and crucial instruments, which did a massive difference to the outcome of these patients. Now, one of the equipment is a functional electrical stimulator, because we all know when we look at a patient who is paralyzed, his arms and legs become extremely thin because of disuse. Now, this equipment kept stimulating the muscles, and it also helped in re-education of the muscle action, improved the local blood circulation, and it kept the muscles active so that they could be rehabilitated very well. Now, this was a very sophisticated instrument, which also was donated by the Global Grant Project. When these patients who are paralyzed or who are having a lot of muscle weakness, this allowed them to have an improvement in their fine body motor control. And just by this patient shifting the weight on the pedal, he can take the cursor to various parts of the screen. And they learn to actually have a very sensitive and very good control and balance training. Now, this was a very important equipment. And the other was a functional electrical stimulation unit where, you can see that there is a lot of wires attached to this person. These are all artificial stimulation of the muscles, and it keeps them going. And there is a lot of coordination which is brought about, and this keeps the muscles going. And the other next was this elliptical trainer, where there was a lot of coordination taught and trained between the motions with the lower limb and the upper limb. And it also helps those muscles specifically which are in mobility, gait, and balance. So all these were actually really good, and we also had a donation of the ultrasound scan. Now, this was very critical for us because whenever these patients came for follow-up, one of the ways that these patients died was by getting urinary tract infection. They got kidney stones, they developed cysts and also secondary cancers, and they died. So having an ultrasound machine there was really good to make sure that these patients were not getting these complications, and that improved their, reduced their mortality quite a lot. Now you can see that in the last 1 year, we actually aimed that these missions should be useful for nearly 250 to 300 people. But I'm really glad to say that 538 patients have been rehabilitated, much more actually. And 538 were from India, but you can see that patients from Maldives, Bangladesh, Yemen, Malaysia, Saudi Arabia also were a part of these people who were benefited. Now, on the states, you can find that 429 from India were from Tamil Nadu, obviously, but 72 were from Kerala, which is our next biggest draining area. 6 from Andhra, 6 from Karnataka. But you can see a lot of people were even coming from Madhya Pradesh, Uttar Pradesh, and 1 patient even from Delhi, and 3 patients from Assam. So this is a wide area over which patients have really benefited quite a lot. And within Tamil Nadu, you can see that the spread is really huge. So although that this was aimed, we are situated in Coimbatore, you will see that only 53 persons are from Coimbatore. All the rest of the 600 patients are from outside. And we should be happy that this project has had such a massive reach. So what have we achieved by doing this rehabilitation? We have to be actually sure that these results have been hugely disrupted, actually so very well. Now you can find that I put many of these parameters earlier to say that these parameters were showing an outcome worse than cancer. But you can see after we did this, there has been a tremendous improvement. Now, mortality for these patients at the end of 1 year, from 27.2%, it came down to 8%. And this is something really, really very good. And this is almost to the level of international standards. Complications which the patients got, like pressure sores, and when you get grade 4 pressure sores, the back is like this, and they don't even know that they have got a big sore in the back. This is a source of infection and which patients die. Now, this came from 25% to 4.8%. Now, secondary killers of infection, like respiratory tract infection and urinary tract infection, also you can see that there is a huge decrease. Now, what is very important is that they not only kill the patient, but they come recurrently. And these patients have to spend a lot of money on antibiotics, drugs, and they get repeatedly admitted in the local hospitals. And that completely drains the paralyzed patient and his family. So many of these patients, repeatedly when they get admitted, at certain point of time, the family gets very fed up with the whole situation. And this is a very, very sad situation. And suicide rates in our cohort actually reduced from 4.2% to 0.5%, which means that actually shows that their mental well-being and positive outlook also was very good. And severe depression was reduced from 21 to 9.4%. Now, the other important thing is, why do these patients suicide and why do these patients go into depression? Because they are completely dependent on other people and their self-esteem goes down quite a lot. One of the best ways that they will feel very good is if they are able to return back to their work. And you can see here in patients who had paraplegia, nearly 50% of them were able to go back. Now, if they are educated and if they were in an office job, almost all of them went back to work. But if they were not educated also, you can see that they all returned to work. This is a young man who came to us 1 year after this accident. For 1 year, he had been just lying down and he came with the pressure sore and he got operated. And after 1 year, he stayed in the rehabilitation center for 2 months. You can see that these patients are all permanently paralyzed and he has also got a urinary catheter. But due to the application of many different types of rehabilitation program, that you can see that in about 6 to 8 weeks, he is still paralyzed, but he is able to be independent. Now we are also teaching how to get over Indian roads by creating situations similar to Indian roads. And at 8 weeks when he went home to Kerala, a Rotary Club there actually also donated an auto rickshaw for him. And you can see that this is a big success story. I mean, he is not only independent, he doesn't need anybody to look after him. He can do every single thing by himself. But not only that, he has now become a yearning member of the family. And he is actually also a very prominent person in the Auto Rickshaw Drivers Association over there. Now you can see that he does his full day work, and just like any other auto rickshaw driver, and then comes back and he can get back to his home and do everything. So from a person who was lying down for 1 year with a pressure sore, getting admitted into his local hospital frequently, he has become a completely a symbol of independence, a symbol of courage, and a symbol of self-determination. Now, people who are educated, now it's easier for them. Now, this is a person, again, completely paralyzed. No control of his limbs, but you can see over the second week, many different exercises are done. And you can see that their family members are also an active participant in their training programs. Now, this is exactly what is really good, because the rehabilitation center actually brings not only lots of patients together, but their families together, so that each one is a source of confidence building to the other person. What is very good is you will find that a family member of one patient actively training and helping so many other people also, and they become a large community which works. Now, after they are all well trained, now you can see that this person has been complete. We also do home visits to them frequently from time to time, so that we know what are their problems, and we avoid complications. And you can see that he is a teacher and he is able to do everything from his home. Now, this again is a person who you can see he is using every one of the equipments that were purchased through the global grant. Now you can see that he is doing all the exercises, electrical stimulation, and everything. And you can just going forward, and you see that the upper limbs, the lower limbs, everything are trained very well. It does take about 7 to 8 weeks for each of these persons to become normal. And you can see with very minimal orthotics, he has fully recovered and he has gone back to his home as a tailor. Only thing, before he was using a manual tailor apparatus, sewing machine, but now he has a motorized sewing machine on which he is now as busy as before. And what is more important is that throughout the day, there is no family member who needs to look after him. So his wife, who is also working, can go to work, children go to school. His brother or any other family member is not handicapped by having to look at him, and that is a very big deal. Now, even in patients who are not, I'm just putting up this case as a case study, which I'm going to talk later. You can see he is uneducated. He was in public work, hard labor. Same thing. He goes through the 8 weeks of training. And then when he goes home, you just see, one more thing I want all of you to see is that none of them are actually depressed. And that's the confidence that they get back once they are able to come. So the local church there actually set up a petty shop for him, and we also supported him. And from morning to evening, so he was very confident that he can look after his 2 children over a period of time. And this is something that you can do. This is a stunt driver, but if they have a partial injury, it is quite easy to do this massive surgery. He's from Uti, and you can see that we can do. He is a case which most of you have seen, so I will skip that. He completely recovered back and went back to stunt bike riding as before. Now, this is something that I wanted to tell you. What it does for the psychological effects for them. I had previously mentioned that we were getting almost 12 to 21% divorce rates in the matrimony. And there was a huge depression scale on the family members also. But what has come out of this rehabilitation is we have had 4 of them actually marrying after they have become paraplegic. Now, this is something fantastic. And this, if you see the date here, this is an engagement party of this group just last week. August 21st, 2020, one of our patients got engaged. And she actually sent these photos to me. Congrats to my doctor, engaged. And it is impossible for any of us to find out who is the person who is the life savior and who is the person who is giving. And I should congratulate the other person. I'm not going to tell you who is the person who is paralyzed, but we should also congratulate the other person who actually, every year we have an annual meet for all the paralyzed patients. And the other person came there as a volunteer, at which time they met, and they have been knowing each other for more than 2 years. And then with the full support of both the families, this engagement took place just a week ago. So I think we should all pray that they should have a very happy married life. Now, the subsidy of this, I would also bring it into the factor because Rotary has brought all these equipments free of charge. So a large number of people can be treated this. If you take the duration of the therapy, and if you look at just ordinary physiotherapy for 1 hour, most of the hospitals charge rupees 300 per day. And if expensive equipments like what we are using are used, the charges are about 750 rupees per day. But I have just calculated at just taking as 300. And if you look at it, the average subsidy that the center provides for this patient just in rehabilitation cost, not in the bed charges and not in the diet charges or not in other medical charges, because the entire medical team provides their medical costs completely free of charge. So we are actually subsidizing the patients quite a lot. Every single patient is subsidized for more than 75,600 rupees. And if you look at the cost, then for the 552 patients that the Rotary, they went through this program, the actual subsidy comes to more than 4 crores. This is something that is really good. But more than the cost, it's the amount of a rejuvenation, a rebirth that we are able to give for these patients. Now, this whole project also was recognized by the IMC Ramakrishna Bajaj National Quality Awards, because they said this is one of the very innovative projects where an end-to-end care was given at one place where it was needed most. And the way we had brought down all the complication rates was also given an award for best practices competition across the whole country. So it is all very good, and Rotary is known to make huge changes in the world. Good example is Polio Plus, but for Rotary it would not have happened. And Rotary always looks at health, it looks at environment and other things, and I'm very glad that I have to thank our Central Rotary Club and also the many people who made this possible in our club. Once the global grant was got, I also came to know that many members also contributed very generously for getting up the fund which was required. And throughout this whole process, I was totally unaware of this, probably because I was not attending the Rotary Club meetings at that time, but still, I mean, I would have been so happy to actually give the fund, but it is the magnanimity and love and of all our members that made it possible. So I have to really thank Dr. Prakash, Mahavir Jain sir, Balasundaram sir, Suri sir, Ashwin Kumar, and also the president, our Manikam sir, and Amit Duhar for making this happen. So we have come a long way. And I'm just wondering whether we should stop here or whether we should go forward. And I just think, what is next that we can do more for them? And we're in the process of doing this. are a lot of things that we need to do because because all of them are from low socioeconomic breadwinners. Once they get paralyzed, many of them cannot go back to their same work which they are doing, and so they need a different vocational training. And a formal vocational training program for these people is a must. And this will be a great thing for them. People who have been doing different things have been this. This was a project done by Rotary City for a few years with the center. They were trying to get them vocational trained, either into artist or printing or as tailoring. And Avanashlingam Home Science University departments also helped us quite a lot in this. And these are some of the artwork which were produced by the other people. But however, this was not successful because market work done by them was big. These people were all spread and scattered across the state. And there was no formal way in which these could be actually got back and marketed. So if such a thing could be done, it will be really useful for them. There are many things that, many jobs that these people can do. I mean, educated people can always go back to their same jobs, but other people can also be given many other jobs, like persons who operate the lift or people as security at the gates and other things, car passes to be given. These people are excellent people. And we also created a printing press within the center so that many of these patients can be taught with the different processes and stages of printing. And you'll be glad to know that virtually every single print in the hospital, for our hospital, is done by these people over there. So this is pretty good. The other major thing that we need to concentrate on this is to get a good orthotics and prosthetic center for them. Good calipers, good wheelchair, and good other aids are lifeline for these people. Now, if you have any of these, which are important for the paralyzed patient, but if they are not ill-fitting, they not only do no good, but they also create a lot of complications for them. Because you only need to have an ill-fitting caliper, and before you know, because these patients don't have any sensation, these create a pressure point, and the patients will come back with big ulcers on their buttocks and around the knee, and then they go many steps behind. They are also a huge source of infection. Similarly, they are spending all that time on a wheelchair. The worst thing that these patients can have is a wheelchair which is not made correctly and which has a pressure point. And you will see that they get a complication in no time. Now we are getting all these wheelchairs by in alignment with an organization called Motivation, which is a UK-based organization. They are giving us excellent wheelchairs for a subsidized price. But if Rotary can think of a very advanced and sophisticated orthotics and prosthetics, then it will be a big contribution, because this is the need of the hour. It will be useful not only to patients with spinal cord injuries, but also to a huge amount of handicapped people who get handicapped because of a lot of other problems. Another big need for these people is educational support for children of the spinal cord injury. Now, these people are all getting their injuries by accident, or they're all very active people who are doing very labored jobs and falling from heights. And very often you will see that this is the sort of children that they have. Children in kindergarten, children who are in primary school. And education is very expensive nowadays. And even if they are going to government schools, they all need a certain amount of support where they will be guided through. Otherwise, what happens is these children quit school. And in the first true story that I told of Palanisamy and his family, one of the reasons that they decided that he should die was because the children were not able to go to school. Because the mother had to look after him continuously, children had to be involved, and all the money that they had was just going in treatment of his complications. And so we need, if anything we could do formally. I mean, the center by itself is doing a lot. We support a few cases. But to look at 500 families and to look at an organized way in which education for them can be supported or at least guided partially, I think somebody as big as Rotary has to get involved in this. And lastly, we can do anything and everything for these people, but we can't make them normal again. That's impossible. I mean, we can't completely remove the mental agony, the loss of self-esteem, the disruption of the family, and the broken individual. So we need to look at spine injury prevention programs. Now we are doing a lot through UYIR for preventing the road traffic accidents, but that's a big thing. But also in our country, one of the main things that we are facing is people falling from the trees, and people falling from labor, people who are falling from electric posts, people who are falling from buildings. And in the last few months of COVID, while the road traffic accidents have come down, there is a lot of people who are falling down. It's not just the laborers. Many of the people who are locked down at home are sitting on the balcony and falling down. Many of the people are building a small building and a small water tank and falling down. Now, all these people, it is completely preventable injuries. So there also needs to be a huge rally. We need to do a huge educational program on how to prevent spine injuries. Because each one of these spine injured, paralyzed patient is not only a big drain for their whole family, but actually is a big drain for the whole society. And there are so many opportunities on which Rotary can get involved in this, and it will be a great contribution to the society. Lastly, I have spoken about this to Balasundaram sir many times. We built a state-of-the-art basketball court. I mean, this was by a request by a small group as to, we are all here in the evening, so can you build a basketball court? And Rama was a big push for this. She was strongly advocating. Initially, I was just thinking this is a crazy idea because they can't even walk, but how can they even play basketball? But once we built it, I think many of the Rotary members have we also hosted the state basketball competition. And the Rotary members who have come and seen this would have just seen that the excitement, the fervor, the enthusiasm, and the way they were playing was completely making us feel so much into the game. So if this could be done by a small thing, but we have not done anything in a big way for disabled people and sports. And at that time, I was also surprised to know that in the whole of the country, whole of the entire country, there is no place for training for the Paralympics. Entire country there is no training center for Paralympics. Now this will be a big program, but nothing is impossible if all of us join together and do. It will be a great, unique project. It will be something which all of us can be proud of. If we make it possible for a gold medal to come in future in any one of the Paralympics, because we need to only concentrate on 6 or 7 sports and have formal training, and then it should be possible. So if we commit ourselves to the disabled people, I don't think it is just in stopping them from dying, not just reducing the mortality, but actually we have to enhance their daily activity, not just in their family life, but also in their professional life, but also in their leisure time activities, and make them actually a wholesome person again. So I hope that the collaboration that we had and the great contribution of the Rotary, I was just thinking this is what we need to do for prevention program. But we need to have more and more collaboration, because what we can do is quite actually much more, and there is a lot of good opportunities for us to do. So I should actually thank our staff team. My involvement in this, while I feel very proud about what we are doing in Ganga Hospital, I feel actually more proud of what we are doing in the rehabilitation center. But actually my involvement is more in the hospital, and it is actually Rama's push and involvement which made the whole center come through. And I should also thank our staff for this. If you be there and see what they are doing, you need to have the extreme patience to treat paralyzed patients and to bring them to independence. I mean, to have this group of people always smiling, always encouraging, and always pushing them through. You can see this is the core team. And you can see two of our patients actually became our staff on the administration side. And this was a picture taken during the Independence Day while flag hoisting was being done. And this is a large group, not just the rehabilitation and physiotherapists, but also the psychologists, the nurses, the housekeeping staff, and everybody. And I thank each one of them for that complete dedication, because it is not just ordinary physiotherapy. You need to have a complete commitment over here to get things done. So a big thank you to our Rotary Club, and also to every one of you who powered this project. You can be really happy that it touched more than 600 people, not just them, but 600 families, and it created a big transformation in their lives. So thank you also for giving me this opportunity for presenting our global grant project. Thank you.
Thank you. Thank you, Doctor. Thank you.
Thank you, sir. If there's something that anybody needs to ask, I can answer.
Rajasekaran, this is Dr. Ramchandran. Can you hear me? This is Dr. Ramchandran.
Sir, we can't hear you, sir. I can't hear you at least.
No, I have unmuted. No?
Okay. Yeah, I can hear you, sir. Yes, sir. Audible, sir.
Okay. In our field in kidney transplant, we all discuss about the supply and demand situation. In a country like ours, the demand is huge, whereas the supply is very little. So can you just throw us some idea about the same situation, supply and demand in the spinal cord injuries in this country? And other than Coimbatore, any center doing this kind of a work?
Yes, sir. Sir, this is supply demand is, the demand is too much overpowering on the supply. So actual statistics of what is the incidence of spinal cord injuries in India is still unknown, because most of these falls from the trees and in rural areas are going unrecorded. And when people die, they just die and it goes unrecorded. But what is talked about frequently in the medical circles is there are 40,000 people who become paralyzed every year because of spinal cord injuries. And this 40,000 is spread all around the country. And to date, there are only 4 centers which are dedicated to spinal cord injuries. So we have one in Delhi, one in Patna, one in Vellore. There is one also in Nagarkoil, but they are looking at everything from stroke or cerebral palsy or multiple sclerosis or all neurological. But ours is the largest center which is dedicated only for spinal cord injuries. So now we have nearly 35 beds, and every other center, even the largest center before the Indian Spinal Cord Injury Center, has got only 26 dedicated beds. So the demand is huge, but the problem is the same that they find in Aravind Hospital, sir. Aravind Hospital, they were willing to do cataract surgery, but many of the patients were not coming for cataract surgery because there was nobody to bring them to the hospital for surgery. I'm sure Dr. Ramani is here. He will also tell that they must have faced the same thing in cataract surgery. Cataract surgeries actually went up only when the hospitals went to the place. They took the responsibility to bring the patients for surgery and also left them back. I'm sure that Shankara Eye Society is doing a phenomenal job, and they are doing all these things. It is not just doing the cataract surgery alone. They are looking at the whole cycle. The same problem in spinal cord injuries is less than 30% of the people whom we operate are willing to come into the rehabilitation program, even though it is very cheap. And when we ask them why, the first question they say is, sir, கூட்டிட்டு வந்து கூட்டிட்டு போறதுக்கு ஆள் இல்லை சார், இங்க 2 மாசம் கூட இருக்கிறதுக்கு ஆள் இல்லை சார். Because if his brother or brother-in-law or somebody actually has to stay with them for 2 months, what happens to his job? What happens to his family? So this problem of rehabilitation is not just rehabilitating that patient, or not only even just subsidizing the treatment, but it is the big question of logistics over here. So I'm sure that if we tell them, many people will come and tell me, sir, நாங்க இருந்துக்கிறோம் சார், பட் திரும்பி போகும்போது ஆம்புலன்ஸ்ல போய் விட்டுருவீங்களா சார், எனக்கு ஆம்புலன்ஸ்க்கு காஸ்ட் இல்லை சார். So, some small minor things you will find, it's like for want of a saddle, the war was lost. It is like sometimes when you listen to why they are not willing to join, it's very trivial reasons, but it is a big reason for them. But once they, most of them will say, sir, நாங்க வீட்டுக்கு போயிட்டு ஒரு எல்லாம் அரேஞ்ச் பண்ணிட்டு 3 weeks கழிச்சு வரோம், but they never come back. Once they go into Ramanathapuram or they go into Pattukottai or somewhere, then family logistics are completely different and they don't come back. So there is no doubt that the demand is huge, because we are looking at 4 centers looking at 40,000 patients in the country.
Thank you.
Any other questions? President, back to you.
Hello, I have a question.
Yes, sir. Tell me, Krishna.
Yeah, I'm Krishna Kumar. Am I audible?
Yeah, audible, Krishna.
Yeah, I think what you said today was not only totally heart-rendering, but it's also opened up so many avenues for people to do service. I just want to know one thing. You were talking about not getting the right kind of prosthetics or importing a lot of these things here. Is there a possibility of trying to get some technology to manufacture it with a startup or something here so that the cost can come down over a period of time? At least some of the common things where it is not very complicated, which can be made here.
Yeah, definitely. I mean, it is possible. We need to get a few basic machines, and we need to train people to do it. It is not impossible. It is easily possible. It is our next aim is for that.
And I'm sure, like Ganga, there will be so many other centers which will also be in need of this requirement. And it is a social entrepreneur who has to take it up with a social cause and maybe meeting a bit of his profits as well. If that can be arranged, I think it will be a huge service to people.
Yeah. You see, Krishna, just if you take one simple thing of wheelchair.
Yeah.
The quality of wheelchairs that we get is so abysmally poor. So if a patient, just imagine one patient has to use both his upper limb to rotate the wheel and move himself.
Oh.
And if the wheel friction is just 20% more than what it should be, you just imagine how much it is going to fatigue him and how much it is going to restrict. It is just small things. If the caliper for a paralyzed limb is 30% more heavy than what it should be, it is completely going to make him unable to walk. Because even small minor improvements are major benefits for these patients. So the technology has to be in materials that you use, it is in the technology that you use, it is in the design, it's in everything. It is also in the cost, everything. So, in many of these social service organizations, they give these calipers by hundreds from year to year. But these are highly used equipments and they all need servicing. So you give a equipment in different places, you conduct camps and you give calipers. But within 5 months, 60% of the calipers will not work or they need some small repair. But where do these people go again for getting it repaired? So that's the important reason that all these services must have an address, a permanent roof, a permanent place. Wherever something goes wrong, these people must be able to come back to the same place and get it rectified.
Yeah, thank you. I think there's one small suggestion. I don't know how feasible it is. There are a lot of these smart hackathons which are happening all over the country where real problems are being given to students across. And we had one such hackathon which was concluded recently. We can put up this problem solution next time to the PMO's office for being included in this. And if there can be an innovative solution which can come up, I think it can benefit people. Thank you so much.
Yeah, thanks.
President, can I have a minute?
Yeah.
Basically, Dr. Rajasekaran and Mrs. Rama, the way they have taken forward this program, I think all of us in Rotary Central should thank them and congratulate them. Getting the global grant is one. Of course, all our people right from the president have done a great job. So you get a global grant. But how it has been utilized and what is the outcome? Today, as Krishna Kumar said, it's an eye-opener. So all of us know how the whole rehabilitation process is going on. And there is so much of opportunities, further opportunities to expand on this. Thank you, Dr. Rajasekaran and Rama, on behalf of everyone in the club.
Thank you, sir.
Thank you, Doctor, for this eye-opening address.
Thank you, sir.
Spine also is perhaps the most critical bone in our body. We draw strength from it and it drives us throughout our lives. You have given some brilliant suggestions and I'm sure other Rotarians like me will agree with your views. Thank you so much, Dr. Rajasekaran. Thank you.
Thank you, sir. Thank you very much.
Now I request Rotarian Balasundram to propose vote of thanks, please.
Thank you, President. I am very fortunate today to thank Dr. Rajasekaran for
it's most appropriate that he gives the vote of thanks because he's one of the Karanakarta, I said. So without him,
we always select the right person, Doctor.
Thank you very much, Doctor. I am very proud to have interacted with you for this project several occasions. So simple and so humble and giving a lot of time and attention instead of your busy schedule. And thank Rama also for her brilliant contribution for this project. And whenever I visit, she is always there for all the meetings and taking care of the patients. It is something, it is close to your heart. When you said about Palanisami's story, for me, it is the first time that impressed me. And Brother Mahavir Jain, Rotary Mahavir Jain also said that we have to do this project at any cost. And we were looking for partners during Rotary Manikam's period. And that time, I was talking to several clubs.